I was talking about one of my research that I did, which was about HPV vaccine in Rwanda. I was evaluating the impact of HPV introduction on the health system in general in Rwanda. The vaccine was introduced, the HPV vaccine specifically was introduced in 2011, and it has been going on like 3 doses every year till now. So it was rolled out in schools other than age-based because more than 90% of the girls in that specific age were in school. So it was the decision of the Minister of Education and Health to base the vaccination in schools, which would target the biggest group of that age group. And it was rolled in schools, but some few girls who were not in school at that time then were also targeted in the communities and were vaccinated. So it was done 3 times a year to make sure the catch-up was optimal. There were no specific issues, but of course we could not reach 100% of the girls. So, but we think so far the data we found in the literature worldwide, we had one of the highest number of girls that we could reach, over 93%. In some cases, 96% of the girls that we wanted were vaccinated, which we think was very impressive. And that's what led to our study to think what exactly happened and what was the impact on the health system, because there was a huge program rolled over the country. Surprisingly, we found that the impact were positive. The argument we had from other papers was that if you introduce a huge program like that on existing health system, if the health system is not very strong and then you roll up another campaign, it could break up the health system or at least compromise other health delivery systems that were going on. What we found was the opposite. We found that it actually strengthened the health system. An example was that they grabbed the opportunity during delivery of the vaccine to give other services that were not giving to the population. For example, they rolled out health campaigns, talk about adolescent reproductive health. They gave deworming tablets to the students in schools, and they gave different other information that they were not giving. So it was positive to the health system in general. Well, the recommendation is what I put in my paper that we published, is that they could not fear to introduce a new campaign, especially when it is favorable to the country. The other one is that they should take the opportunity, if they target a specific group, to give other information alongside that one. What we found is that we also asked detailed questions about on the days when they delivered this vaccine, did they continue giving the routine services in the health facilities, which we found perfectly kept running. Over 70% of the health facilities, which were, for example, giving antenatal services on that day, they continued doing it and parallel did that. So I think other countries could roll out any campaign and it is strengthen the health system. As long as you roll up the package in the existing systems, it could only make it strong. That's what we're planning to do, especially specifically on the scientific part. We are curious to know now the HPV prevalence in the community, specifically on these girls that were vaccinated, the long-term impact. We vaccinated young girls who we assume are not yet sexually active and therefore not yet infected with HPV. So what we are curious to do is to see in future what happens if there's a difference.